everybody. Welcome to the next episode of Program Directors at Sea. We are here today and excited to talk about our recent match and all of the new residents that we're welcoming into our specialty. First of all, a big congratulations to everybody who matched. We're excited to have you join us. And also congratulations to all the program directors. I know it's a big feat. It's a lot of work for everybody to put into recruitment, and I'm sure we're all excited that we all had such fantastic matches this year. Bryan, I'd love to hear, what were your initial thoughts after you got your match results and thinking about this last recruitment cycle?
Well, hearing you talk about the work makes me think about a question I ask my chiefs at the end of the chief year. I say, hey, what was the biggest surprise that you guys had in the experience of being chief residents? In every single year, they say, we had no idea how much work went into recruiting every year because we have them involved and they're always shocked. I even warned them at the beginning it's going to be a huge component and they're shocked. So it is a ton of work. I'm going to surprise you with a question we didn't think about. I make a little presentation about my new residents. Are you going to use AI next year to help you make your new class presentation?
Great question. I think I'm trying to use AI in as many ways as I can and try to incorporate it, really letting my coordinator team also think about how we integrate AI and how we're going to introduce our residents and just in our the ways we do work in the residency program. But love that idea. Love having, all these announcements made with AI would be so wonderful to see all the programs, make their match announcements.
Yeah, it's a full day process for me because I want to really unveil the new class in a flashy way and make them feel welcome. But 8 hours every year, I could probably give that to AI. Anyway, what are your initial big impressions after another blockbuster year for anesthesia recruiting?
Yeah, I think everybody, when I tell folks that have been in anesthesia for a long time, new faculty, that we filled all of our spots in anesthesiology for the categorical PGY1 positions and most of the PGY2 positions. Everybody's just really shocked, right? Like, it's so fabulous that we're getting these great applicants, we're filling all our spots, and that our specialty is growing. And it's just, I think, good news for us as a specialty and as we think about how our field is expanding. We had a great match. We're really excited for all of the applicants we matched. I think we've talked about this before in previous episodes, but the signaling is working, right? I think that it really helped as we narrow down candidates to interview, but I also think that's being reflected in how we're matching, and we're, truly matching people at the top of our list that have shown interest in our program and that we've felt would be a good fit and a good place for them to come train with us. What were your initial thoughts?
Well, I know the candidates are so ambivalent about the signals. If any of them are listening, listen, guys, it really does help us do a holistic review of your application. When I'm looking at hundreds of signals versus 2,000 applications without signals at the peak, I really can take a deep dive into a lot more applications. An entire selection committee can do that. So I also like the fact that on the front end, we're able to spend a lot more time parsing through people, looking throughout the entirety of their application and finding people we think are going to be a good fit to really take advantage of what is a limited resource for interviews. But yeah, the signals are working. I love the system. I think most program directors like the reduction in the applications they're getting and in the ability to see who's really interested. You mentioned that the categorical spots all filled, anesthesia's in big demand, but those reserve spots, those PGY2 spots were not totally filled. One of my colleagues here in the New York area took him a while to realize that these spots that were once not just gold, they were platinum, they were really, really hard to come by, these reserve spots, crazy competitive, are actually less competitive now. And for the last few years, I have been telling candidates that I have the perception that it's, ironically enough, easier to match into a reserve spot. I think it's indicative of the fact that so many programs are expanding and there are so many new programs coming online, and the pool of people who can apply are limited to those who are either currently in training in some other specialty or just doing an intern year with no plans beyond that. So a lot of the people who are going unmatched over the last few years didn't skip a beat, didn't lose any time. They went unmatched last year and they were able to jump right into a reserved anesthesia position. A lot of people I mentored were able to do that. Are you working with medical students? Are you mentoring people who went unmatched or looking to find reserve positions and helping them?
We have a few that will do the prelim surgery intern year at Stanford. And so they'll meet with myself, other program leadership to talk about the approach to applying to our spots. Do I apply also to categorical and advanced spots and maybe take a year off, do a year of research or repeat intern year? And so I get a lot of emails and questions from also residents who may be having a change of thought about what they want to do. And so are starting their intern year and halfway through are, thinking about other, going into anesthesia. Maybe this is not the field for me, as well as folks that, have completed a pediatric residency, have completed a medicine residency, and now are like, I actually want to do critical care, or I think that anesthesia may be more in line with my career goals. So I definitely hear a lot from them. We have not offered in our spot at Stanford for a few years now. So I think that, we're happy to mentor them and kind of give them advice, but don't necessarily always have spots for them within our home program at Stanford.
This year I have been telling them again that over the last few years, I found our spots to be less competitive. I'm not sure if it's going to remain the case. If I had to imagine based on what I've seen, I think we've peaked in terms of the expansion of new programs and spots, but I could be wrong. So I always do give them the caveat that, we may have peaked and it might start slowly drifting towards those being much, much more difficult. But even though we've peaked, I think we're still going to continue to see a lot of available R spots next year and the year afterwards, as we really struggle to try to catch up with training enough anesthesiologists to fill the gap that we have for the amount of patient care that's out there. So this has been year 3 of the tiered signals, if I'm correct, and year 4 of signals. Is my math right? Is that 3 and 4 correct, or is it 2 and 3?
I started this is my third match where we had tiered. So yeah, you're right. 3 years of tiered and then 4 of just signals.
Are you going to change anything based on what you saw this year over the last 3 years? Do you foresee any changes in your approach to screening, interviewing, ranking?
So this year, as I looked at our data and our match data, we matched a much higher percentage of golds than we've had in previous years. And our approach to signaling since we started was to look at golds and silvers pretty similarly. We didn't necessarily differentiate, but I think that as people are learning more about signals, that programs and applicants are both understanding signals better, we will probably move towards just focusing on our gold signals first and actually looking at them differently than our silver signals next year and seeing how that goes. Because the trend that I've noticed over 3 years is that, we were kind of matching half gold, silver, and then a little bit more gold, like 70-30. And this year we matched like 90% gold and 10% silver. So the trend is, I think if, you're really interested in us, you're giving us a gold signal, and that means that you want to come to our program. And, that I'm realizing with this trend that there is a difference between the gold and silver that we should be looking at more carefully.
I found the same thing. I might have recruited 100% gold. I didn't look at the numbers too carefully, but it might have been 100%. However, this year, PDs and the AACPD has talked about some concerns with the applicants looking at interview rates based on signals sent to certain programs. And so I think the term that came up at our last meeting is they're moneyballing it. They're not actually using the signals necessarily with the programs in which they have the most interest, but rather they're saying, well, I'm going to use a silver for this one because they had a much higher interview hit rate with silvers than this other program, even though I'm more interested because I want to maximize the number of interviews I get. I think that's a really, really wrong-headed approach for the applicants, but it also makes me concerned about maybe having a different approach to gold and silvers. Do you have a different approach, not just in terms of favoring the gold signals, but let's say that you select a bunch of applicants from the gold pool and you have interview spots that you want to give to silvers. Do you look at the silver signal applicants differently in terms of how you decide who's going to get an interview than you do with the golds?
I think we would look at them the same. I don't think we would look at them differently. I think maybe we've always just looked at our gold and silver as one big batch of applications together. But I think next year we might look at our gold first and see how they're scoring based on, our holistic review, and then go to the silver and then decide, where our score cutoff is, like what the breakdown is, and be a little bit more, thoughtful of the gold versus silver, versus in the past, it would just be one big batch of applicants, gold or silver, and we would invite based on their score, not necessarily determining if they're a gold or a silver signal.
Well, I just criticized the Moneyball approach, but I actually think I take it a little bit with my silver signals. With the silvers, I actually screen out the most highly competitive silver candidates, thinking, I'm already your number 6. You're just a lights out candidate. If there's 5 places you like more than me, I'm sure I can flip you about a couple of them, but probably not all 5. So if you're this competitive, I'm not going to spend that like valuable interview on you. And what I've done actually is look for people who might be ranked lower or screened based on some factors. For example, like an average USMLE Step 2 score. And then I'll delve into their application and look for things that tell me I would really like this person, think they'd be a great resident, maybe really great clinical rates or clinical comments, other features. So even if I'm currently sitting at number 6 on your list, and I have to assume that based on how you've signaled, you might just fall down farther on the rank list of places that even at the end of the season you prefer, but I think you're great. So I am being maybe a little bit overly strategic. But I'm what they call more of a I'll say I'm upper mid-tier program here on the East Coast, maybe not as Stanford. But did you notice, and we talked about some of the changes on our end, we read all these things about applicants, we look at their hobbies, or maybe we just hear through the grapevine what they're looking for. Did you see any shift in terms of the priorities that the applicants came to you with that is a continuation of a shift or something new?
I think what we often tell applicants that are applying to our program, and probably very similarly to many, right? We do a holistic review. And so we really want to see like the depth and breadth of an applicant, right? And so we want to see that they're involved in a lot of different interests and passions and not necessarily just, put all my effort into one thing. And so I think as you're looking through these applications and you look through their, activities and the things they've been doing, it does really span things from a little bit more community engagement to research. And so it spans a broader topic base is what I've noticed over the past few years compared to when you would see an application and it was really just focused on their one major passion and multiple activities based on that one thing.
But did you have a sense of what they were looking for when they came to you? Like the kind of questions they were asking? Do you feel as though applicants are looking for something different from a career in anesthesia? I mean, we're so highly competitive now. I think we're probably tapped into a different kind of applicant pool. Did you hear anything, maybe even behind the scenes, about what the applicants want?
Oh, good question. Sorry, that was not what I interpreted your first question to be. So we at Stanford have lots of different pathway programs that are focused on interest within medicine, not specifically anesthesia, but like medicine globally. We have a big innovations program. I think people think Stanford, they think tech, health tech. So we do get a lot of applicants who are asked about those opportunities, right? Opportunities to network in Silicon Valley while you're in training, opportunities to, meet people within the School of Biodesign and get involved in startups and things like that. So I do get a lot of questions focused on kind of, the other opportunities that one may have during residency to explore. But I think that's maybe specific to where we're located and kind of the connections that we have at Stanford. We also get a lot of questions about global health because we have a big global health program. I think there's also, a lot of interest within academics and learning more about medical education and how to be an educator as well as a great clinician during training. So I do think there's a lot of, at least for us in our program, questions about what's the other interest that I want to continue to pursue that I'm passionate about, and what opportunities will happen.
Marianne, yeah, we've been seeing still a lot of interest in global health. And for listeners, we recently recorded a session speaking with heads of the ASA and SEA global health trips available to residents. So if you are listening to this and you're thinking, oh, we need global health opportunities for our residents, you don't have to make them in-house. There are opportunities available through our professional societies. We recently decided to sponsor a position with the SEA HVO Global Health Fellowship, which can help to enhance the chances of one of our residents getting one of those positions. It's an additional one because we're paying for it. and is really not that expensive. So PDs out there who are looking to expand global health opportunities, it's easier than you think. Marianne, have you sent any residents to the SEA or ASA global health trips recently?
Yes, we've had one just recently accepted, and so we'll go next year. And we've had a resident who went this past year as well. And so we encourage residents to apply through those opportunities, even if we have our own in-house opportunities.
Well, that's some free advice for program directors, even new program directors. And we have a lot of new program directors out there. During the SAAPM, we have new PD sessions because there are so many. Based on what you've seen, let's say you were speaking to someone who's starting a new program, let's say down the street. What advice would you give to a new program director in light of your recent experience and the recent changes to the interviewing recruiting process?
I had a new-ish PD recently ask me how we make our rank list and, how do we determine, who goes in what position. And, I think a lot of us think about how we can, make sure that we're matching the folks we want to come to our program and, ways that we can, move people around the rank list to make that happen. But I, gave her my advice of just rank how you normally would, just, based on the interviews, how you score, and the algorithm works. And, I think that's shown every year as we all successfully match really wonderful candidates. I also told her that, it was my third recruitment, my third match, and I still, right before I submitted our rank list, woke up to make sure that it was certified and did all those things that haunt me of, making sure everything is done correctly so that we can, have a successful match. And that, still happened to me this third year around. I'm sure for you, as a veteran PD, you submit your list and don't think about it. But for some of us, still wake up, sweating to make sure we did the right thing.
No, not at all. I still have a panic attack that I did not certify my list appropriately. I might check it 3 or 4 times just to double check. So that never goes away.
Good to know. I was like, when will this end? Will it ever end?
So the match algorithm does work. I mean, how about your algorithm? Did you give them any advice about your approach in terms of the interview versus hard data?
Yeah, so I think that every program needs to think about residents that will be successful at their program and what surrogates we have within the application to kind of help us make those decisions in addition to the interview. So everybody's going to, I think, have a different, review and how they give priority to certain things versus others. And so I think that's a very much an internal question. You have to talk to your program leadership. You have to talk to your chair and kind of come up with those priorities. We've tried in our program to look at past match data, to think about how we used to look at files and our score sheets and come up with, some way to determine what's worked and what's not. Unfortunately, that's challenging, right? I think that, there's so many different parts of, pieces of the puzzle that we look at. There's not one correct answer for any one program, but it's good to, kind of look at your match, maybe iterate on what you've done to try to make things better. At the end of the day, I think there are amazing students going to anesthesiology. So I think we're very fortunate that we're all going to match really great candidates that are going to be really successful. So that's also kind of just a nice feeling to have that, the application pool is super strong and, we're all going to be able to work with these really great residents and help our field.
Well, I've thought about the same things. We want to look back and see how we're doing in terms of our approach, but it's hard. My residents say, "Oh my God, you guys do such a great job. I love my classmates." And I say, you'd actually be shocked at what a bad job we do. Because if we think about the order in which people are ranked coming in and their success throughout residency, it seems a lot more stochastic and random than one might think. We do something, we select chiefs with a vote. So all of the residents and faculty get a vote. So the one outcome variable we do have, and I've thought about using this, is looking at the number of votes people get for chief, because it shows esteem across both faculty and residents. And again, here's AI again. Maybe AI can help us look through applications and application data and see if there's anything to take from it that can help us modify our internal algorithm. I think, we're always looking to do better. And we always feel bad when someone doesn't do as well as you hope they would in residency. You guys seem like a great place to do that kind of thing, using AI to assess the success of the match. Have you looked into that?
Actually, perfect timing for this question. So I just met with some of my residency associate program directors yesterday, and we were talking about using AI to actually look at letters of recommendation, given that we think most people are using AI to generate those letters of recommendation. And so kind of in the past few years where there's probably more AI generated letters, are there kind of key phrases, words that are being used that either help us or maybe hurt a candidate in terms of how it's written or what is being said? And so definitely thinking of different ways that we can use AI to assess parts of the application and then looking at outcomes. Yeah. So we're excited about the possibilities. I think they're kind of endless. We just, kind of need to sit down and do some work to see what happens with it.
So we talked about the PDs. You're meeting with students all the time. I get so many requests for people to talk to them about, applying for anesthesia. What kind of advice are you giving? Are you giving any new advice to candidates who are applying, say, next year, based on the changes you've probably seen a lot of changes even over the 3 years you've been doing this?
I think that we are fortunate at Stanford to have really great medical student clerkship directors that are involved in the recruitment process and have really great advice for the students. And so I think we're fortunate that the students that come speak with us are getting advice based on, trends, updates to how signaling is working. We, over the past few years, I've definitely told students to get as much exposure to anesthesiology as they can. I think it's a field that's changing in lots of different ways. And to understand that will better prepare them for, what they might expect in residency and in their careers. I think, for many of us, we would do a 2 or 4 week rotation and kind of apply to anesthesia based on those experiences. But, there's, so many new subspecialties and ways that people are practicing. So I always tell the students the more exposure they can get to the different types of practice, the better. So they have a clearer understanding of what they might be getting themselves into, as well as the way that medicine operations are changing is ultimately going to affect what we do, right? Because we're so intertwined. And so that's usually the biggest advice I get, that it's like they know, this is a career you're choosing, and we don't want people to go into the field if they're not necessarily understanding the complexity and breadth of what we do. And then I'd hate for them to realize that halfway through residency and decide maybe this is not the field that's meant for them. But what advice do you give your students?
Well, I guess I'm going to ask you another question first. Is there anything that you think applicants or students don't know about our field with the limited exposure they get? Maybe you have residents who come to you later and say, wow, I didn't expect a career in anesthesia to be X, or I didn't expect to deal with issue X over the course of my training and in my future career as an anesthesiologist. What don't they know that you want them to know before they jump in head first?
Probably lots of things. I think that even as a resident, there is things that I didn't realize about anesthesia, and as things evolve, even as a faculty member. Do you guys have your students take call on anesthesia?
So that's great. And so you're kind of pointing out one thing that's at the front of my mind. I actually sat down with someone today who was thinking about a transition to a career in anesthesia, which was a big decision for them. And I said to them, let's really talk brass tacks here, because this is a major decision for you. Anesthesia is not a lifestyle profession. I think people perceive it to be. I always say the one thing no one realizes before they go into anesthesia is how many times they'll be sitting in an operating room in the evening, not thinking they would be there that late and not knowing when they're going home, because, we're tied to the operating rooms. Sometimes multiple surgeons have cases that take longer than they think. There are add-ons, there are emergencies. And if there's a room with surgery going on requiring anesthesia, there's an anesthesiologist in there. And I almost wish, in addition to our physiology talks and our area workshops, we had a whole lesson on the unpredictability of the day-to-day life of an anesthesiologist. And for that reason, I think them taking call would be great. We do not do that. In fact, our residents want to be nice and oftentimes send them home earlier than we want.
Same thing with us. And I think that you're right. I think there's a lot of students who don't realize we have emergency operations on Saturdays. We have to have emergency operations at 3 a.m., right? You're an OB anesthesiologist. The L&D floor is always busy. There's never a time that it's not going to be busy. Christmas Day, it's going to be busy, right? New Year's Day. And so I think that having, some call or some understanding of the evening work and the unpredictability of days is important because it will affect them during their entire career unless they go into pain medicine. But for most of us, it'll affect us, still. And it's part of what we do is that our schedules are not our own. Our schedules are based on, the surgeons we work with, the patients that need care at all times of the day. And so we do not have them take call, but have encouraged our medical student clerkship directors to think about that more and how we can incorporate that to have a more realistic understanding of, how we practice 24 hours a day, 7 days a week.
We would just need to find a call room for them. But, you could probably make that change because I'm sure you have medical students beating down the door for an opportunity to do a rotation with you.
Yes, I am not directly involved in our visiting student application process, but we have recently joined the VLSO program or process for visiting student applications, and recently was chatting with our medical student clerkship directors, and we received a very large amount of applications for very few spots. I think it's also hard because most of the students want to rotate in the summer and fall, and that's when we're onboarding and orienting new residents, and it's hard to find them opportunities to, be either one-on-one with the faculty or a senior resident, which is how we pair our students. And so I think that trend is definitely going up. What are you seeing in terms of the visiting medical student applications and how you're going to approach that this year?
Well, the demand is huge. You get multiple applications from a single applicant. So they might say, I'm willing to come for this number of months. So accounting for that, I believe this year we have almost 1,400 applications for
That's
rotation.
crazy. That's a crazy number.
It's a crazy number. And a few years ago, I decided to be much, much more involved in the selection process for a couple of reasons. One, it's the absolute best way to get to know people. If you work with someone for a month and you get to know them, nothing's ever 100%, but the certainty that you're getting someone who's really going to be a great fit for your program increases dramatically with that experience with them. So it is the single best means for finding the best applicants for your program. And two, what I realized is they're so desperate to get these away rotations that they're applying very broadly. And in the past, I think that the administrative staff who helped us sort through them were not doing it as early in the season as I hoped. And I think a lot of great applicants were already committed to getting the first offers they got because, a bird in hand is worth more than two in the bush. So the second it opens, I've actually started reviewing and divvying up applications for a small cadre of both residents. We actually have our education track residents now involved and faculty involved with our medical student rotation. I think that we sent out the vast majority of our invites within the first week after VSLO opened to try to get the people that we most wanted to come see us. And we also extended our away rotations. We used to end them before December, and now we have them coming up until rank lists are due, thinking that people who are really, really interested will make it happen to be here in January, to be able to, get a face-to-face opportunity to work with us and expanding our opportunity to meet great applicants. Is any of this consistent with what you guys are thinking about doing now that you've joined VSLO?
Yeah, are definitely trying to sort through them earlier, getting invitations out a bit earlier. We're a little bit limited by how the Stanford School of Medicine works in terms of scheduling clerkship. So we actually don't even get access to some of the applications that are later in the fall, not until like next month. So it does delay the process a bit just based on kind of the School of Medicine's timeline. How are you approaching the applications? Do you approach them like you would a residency application and, who you're deciding should get an interview? Like, is there certain things you're asking for that may not be part of like the standard application process?
In some instances, you do not get the same amount of information through VSLO that you get URAS. You're not getting board scores. They haven't taken it yet. You're not getting a dean's letter. It hasn't been completed yet. They'll all upload their transcripts, some of which don't even have grades or rankings because that doesn't get decided until later. So basically we get a resume. We have been telling the non-allopathic students that we do need to see their transcript we will every year consider a very, very small number of non-allopathic students. And I want to make sure that they're not wasting their time. So I want to see a transcript that just shows they're going to be a lights out candidate and be, considered to be ranked appropriately if they do a great job. Other than that, I'm just looking through resumes, and I'll actually give you a little anecdote. I was perusing resumes last year, and I was in the OR. There was an intern that I was training, and we had some major downtime. So I'm just perusing. And I think she overheard me say, oh, this person majored in history. That's cool. I want to meet them. And they said, to think that something so random can alter like the trajectory of a person's entire life. But when all you have is a resume, I'm just looking for people who I think are interesting, fun, are going to bring something different. And actually that influences when I talk to people in undergrad who are applying to medicine, they all think they have to study biochemistry. I said, oh, for the love of God, study philosophy, study religion, do something interesting. You need to know how many biology majors we see here. We don't need more. So it's actually just hobbies, what they studied, some of the things they were involved in play almost a bigger role, I think, in selection because you don't have other screening mechanisms. How about you guys?
Do you offer all of your visiting students a interview?
I do, but that's a little bit complicated. So I have been convinced, I've been won over, that all students, regardless of whether or not they do an away rotation or are a home student, should be signaling appropriately regardless, i.e., if you do a rotation with me, you should still use a gold signal if I'm in your top 5. The reason I've been won over to that argument is that it really messes up the data that students are getting. And if they are trying to gamify the data, then they're getting bad information to make their decisions. So my dirty secret on a podcast everyone can hear is that I would never not interview someone that did a rotation. I don't think the fallout from that is worth it. But I am going to tell them that they need to signal me in terms of how much they're favoring our program. So use the signal the same as you would for any other program. How about you guys?
Yeah, so I'm probably guilty of presenting bad data and not helpful data. So we will now tell all of our students and visiting students, all of our internal Stanford students and visiting students to signal as they would if we're in their top 5, in their top 15, because we were previously not. So we will switch that this upcoming year, make sure the data is accurate. And in terms of how we look at applications, my 2 medical student clerkship directors are also in our recruitment committee. So they, are hearing about, the things that are talked about, what we look for in the applications. And so try to mimic that a bit with the information they're getting. But like you said, it's very limited compared to what we get through ARIS. And so making kind of, decisions based on like little connections, things that stand out in an application. But it's challenging just because I think there are so many applications to go through. And, after a while, you don't want to kind of play into your biases, and you want to make sure that you're treating each application fairly. So I'm glad that I don't personally participate in that, but I do trust my clerkship directors, and we've had some really wonderful visiting students who have matched with us. So know that the process is working, and hopefully will continue to grow and develop.
So would you encourage students to pursue away rotations more than maybe they've been told to in the past?
I have mixed feelings about that. I really think the visiting rotation is for the benefit of the student, right? Especially as we're doing virtual interviews, a student can have the opportunity to meet the residents and faculty, kind of experience the culture of a place, experience the workflow, see if this, importantly, is a place they want to live for 3 to 4 years, right? Especially if they've never lived in the area before or coming from across the country or a different part of the country. It's really an opportunity for them to just really immerse themselves in what their life may be like for the next 4 years. And so really see it as for the student and not necessarily for the program. And they can make, more educated decisions as they make their rank list and after they've interviewed. Again, I think that it's not an opportunity that everybody can do. So there is inevitably some inequity to the process, which I don't love. And so I don't want to put too much on the visiting rotation just because not everybody can do it.
Mount Sinai actually offers a scholarship, a needs-based scholarship to students who are interested in doing a rotation within the Mount Sinai healthcare system. And it's a cost that's borne half by the medical school and half by the receiving departments. So for those of you out there, if any students or applicants or even people mentoring them are listening, there are programs that do offer some financial assistance for away rotations to try to even the playing field. That might be actually a good topic for a future discussion. But it's been another thrilling year. Any other topics you think we should touch upon before we sign off on this episode?
No, I think that, I think we were excited to kind of get through another recruitment cycle, excited to, see some really wonderful match results, and excited to start this all over again soon. There doesn't seem to really be a break ever in recruitment. And, you started talking about how your chiefs were, amazed by that. I think my chiefs similarly said, like, recruitment really never ends. There's like never really a break and stopping to think about something else. And I'm like, yep, think about it all the time, all year round.
Actually, I'll sign off with my last bit of advice for new program directors. All the work you put in on this end, it's all worth it. The extra time on recruitment saves you so much headache and heartache on the other side of things. So if you think some people are crazy with the amount of energy they put into recruitment, they're spending a lot less energy on dealing with problems because they didn't put enough time into recruitment. That might be the best advice I could give somebody.
So true. Love that. Well, thanks again, Bryan. Always good chatting. And thank you, everyone, for listening. We look forward to chatting again with you all soon.
Thank you.
Thank you for joining us on PDs at SEA. If you found this conversation valuable, we invite you to subscribe and share the podcast with colleagues who are committed to advancing anesthesiology education. You can access additional episodes and resources from the Society for Education in Anesthesia at seahq.org. We welcome your questions and suggestions for future episodes. Please contact us at pdsatsea@seahq.org. This podcast is produced by the Stanford AIM Lab on behalf of the Society for Education in Anesthesia. Thank you for your dedication to teaching the next generation of anesthesiologists. We'll see you next time on PDs at SEA.